Hi there, I'm Rebecca Williamson. I'm the publisher of Fierce Healthcare, and I'm here today with Dr. Omar Manejwala, Chief Medical Officer at Dario Health. Dr. Manejwala, thank you so much for joining me.
Hi, Rebecca. It's great to be with you again.
Now, one of the big takeaways from the last 2 years is the amount of bias that exists in our healthcare system, and senior populations are no exception, especially when it comes to innovation. One particular bias that existed in the healthcare technology market is that older adults will not adopt telehealth technology and virtual care. But the pandemic challenged those biases as we saw seniors adopt and learn to appreciate the convenience of technology enabled care, proving themselves to really be a more adaptive population than expected. So, telehealth and digital health left a positive impression, and now seniors are expecting care to be delivered in the convenience of their homes. But we've now realized that healthcare technology is not really designed for their unique user needs. Many feel that unless tech is designed specifically for seniors and the variances across that population, we won't be able to engage them effectively. So, Dr. Manejwala, turning over to our discussion, telehealth was adopted by seniors with more than 40% of Medicare primary care visits in April of 2020, which were conducted virtually. Talk to me a little bit about digital health.
Yeah, I have to tell you, that's an astonishing figure that 40% of Medicare primary care visits being virtually. We never would have thought that a few years ago. And we saw, look, well, I think we saw that seniors were extremely receptive. I saw somewhere it was over 90%, actually 91% of seniors who used telehealth during the pandemic had a positive experience from it. And that really opened the door to more technology enabled care, as you said. And then COVID introduced an entirely new way to access care, new kinds of support for seniors, and started to challenge these long held, we'll call them ageist kinds of beliefs that have been in the industry that really are a myth. Seniors turned out to be more adaptive than people realized. And so expectations have, I think, very appropriately changed. There was some research from Deloitte that even showed that the MA plans that were investing in digital for seniors have a leg up in terms of the competitive space. I think the truth is that we've been heading in this direction for the last decade or so, even pre-pandemic, as especially the youngest cohort of seniors who were under the age of 70 were already quite technologically savvy as a generation to start. So now as an industry, I think we have a tremendous opportunity. We have a responsibility to engage older folks with new technologies that make sense for them, that meet them where they are. But success, if we're going to be successful in this space and really help people with their needs, help older adults with their needs, we're going to require some new ways of adapting, of personalizing those solutions to really make sure that we don't fall back to these old and very broken ways of thinking about care for them.
Good. So, Medicare Advantage has been an attractive target for digital health. There's often a mismatch between the technology and the target. So, what are some of the unique advantages in designing for seniors?
Yeah, so I think the mismatch really occurs because so many digital health providers are trying to apply, well, I'll say it like this. If you're a hammer, everything looks like a nail. So they're trying to apply commercial applications to a population that looks and acts differently when it comes to health. I mean, a lot of times we like to say, well, children are not just little adults. Well, similarly, older adults are not just older versions of people. They're unique needs that change over time. And, MA plans have known this for a long time. That they've known that seniors are not just adults who happen to be older. They're using care in a different way, have different utilization patterns, different needs, unique needs. It's more complex than commercial population. 77% of seniors have at least two chronic conditions. The challenge in managing those multiple conditions, it starts to look significantly different in the population. And then, alongside the more complicated care, the more complicated sort of regimens for physical health, there are some unique stressors that come along with that population, with aging, increases in the need for, mental health support. 66% of older adults that are not receiving the care they need, that can easily become a threat to their overall health, their overall vitality. So if you have digital health solutions, let's say that are offering more integrative approaches that address multiple health needs, that look at this from a whole health kind of perspective, that have a more seamless approach, that's going to feel more customized to seniors' needs and lead to better engagement. That's going to be very valuable. And then, there's another place, Rebecca, where digital health really needs to be investing more resources, and that's in how we look at, how we address social determinants. So you got, these factors like social supports. I know you've talked about it in many different places. Social supports, income, food insecurity, loneliness. Those have a much more significant impact on seniors. Those should be given greater weight when we're designing. And when you add all those things together, it very quickly becomes overwhelming. And that's why any digital health solution that not only recognizes the extra health burden that seniors are facing, but it designs an experience specifically to help seniors feel seen, be supported, that's going to find an easier path to adoption, I think.
Definitely. So can you talk through how next-gen solutions are addressing these needs in a way that better uses data and intelligence?
Yeah. So one of the biggest ways, I think, that next-generation solutions, like, for example, ours at Dario, they're having a more immediate impact. And by the way, our population, more than 30% of our users are seniors. So you're not going to see that with digital health in general. You may see it with telehealth. But on the digital health side, it's pretty unique to have a significant portion of people, and there's good reasons for that. One of the key reasons that we do is because we design for that population. We don't just try to apply what works elsewhere there. We enable some very dynamically adaptive, very personalized user journeys for them. And we adapt those journeys to individuals, not just to personas or to fingerprints, but each person, right? Each person's user journey is addressing what's important to that person. So for our senior members, for example, that means we're continuously learning about each person. We're using insights from more than 3.5 billion data points. We customize those journeys across 6 domains. So you have timing, what time do you get the message? Tone, do you prefer a prescriptive tone, a gentle tone? Some people like a little more of a drill sergeant tone for certain things. Channel, what frequency you're looking at, what the intervention is. Staying with members as they change, as they adapt. They have different preferences in terms of how they like to engage. That's really important with seniors especially, because their health needs, they just span across more programs and services. They don't just need diabetes, for example. They may need weight management, high blood pressure, MS, musculoskeletal, chronic pain. They may have lots of different needs together, and spanning across that on an integrated platform is very, very important. Behavior change engine that we use sits on top of all those conditions. Make sure that people get the needs their needs met across a variety of conditions. So if you put all that data, all those intelligence together, what we really have is that we're informing a very relevant experience for seniors on a very individual level.
Very good. So in your perspective, why do you think older adults are often neglected when it comes to digital health design?
I think it's a great question. I think it's a moral imperative. I think we have an urgent need to answer this question. And by the way, it's not just digital health design. We've seen older adults forgotten or neglected in a lot of areas of society, sure. and that's really unfortunate. But in digital, it's almost like there's this bias of like, okay, well, they're not going to use this technology, so let's look at commercial and other kinds of populations. But from our perspective, age is a very important dimension in digital health design, and acknowledging the gap. It's really, really important, because there are so many preconceived notions about seniors that seem to persist, even when you look at hard data on the use of smartphones, hard data on the use of technology, hard data on the use of social media. I think that's another one. So pandemic, I think telehealth, that opened a door for a more meaningful conversation by presenting this kind of clear-cut opportunity. Look, here's a group of people that are using technology. They want convenience. They want solutions that are matched for them. Where are the solutions? Why have they not been built for me? And so I would say bias is part of the answer to I think it's a great question. It starts with gathering data. It starts with listening to what seniors like, what they don't like. what they prioritize, where they find value. It starts with understanding that seniors are not one block. They're not just all one thing. I think there's a lot of bias about looking at things that way. And then, for us, it's a continuous process. It's not a one and done. It's continuously look at our solutions, make thoughtful changes, make enhancement, allow the AI to dynamically adapt to this population, supervise that process, check for biases. That's going to be better and more effective. It's proved for us to be more effective than just trying to pivot some commercial solution with little thought to the end user. We need to make user-centric design that's applicable specifically to this group.
Okay, good. So to close us out, when it's all said and done, what do you think is really needed to drive value for seniors?
Yeah, that's really the question, right? So first, I think in this case, much like any other population, all right, say digital health for seniors needs to be very simple. It has to be easy. You have to make the right thing to do the easy thing to do. You have to focus on what matters to people rather than just what's the matter with people. You have to be relevant. If you're not relevant, a person's going to delete your app, block your text. It's all going to go. It's going to create problems. And the reason those problems exist is because you don't create value for people and you're not relevant in their lives. So nobody, especially seniors, right? But nobody wants to use complicated, fussy kinds of technologies. So that's first. I think it just has to be easy. Second, I would say is we need to be tailoring the solutions to their unique needs, right? That means listening to them, using the data, adapting and personalizing the solutions for experiences that just feel to them like it's worth my time. It's worth my time to do this. Like I've limited amount of time. This is worth my time. This is worth my effort. It's meeting where I am. It's a digital tool that's a part of my life, like other digital tools that are part of seniors' lives. And then finally, and we talked a little bit about this earlier, but I would say finally, the biggest differentiators, those are going to come down to data, integration. Seniors interact with the healthcare system in so many different ways, care management platforms, electronic health records, all kinds of different ways, portals. And, the question is, what digital solutions are going to engage seniors and drive impact? If they're not able to share insights across these different channels, if they can't normalize the data, if they can't put the data and the intelligence in the right time, the place, the format, the frequency that doctors want, that care managers want, that the health plan wants, that others want, how do we do this in a way that doesn't blow up and disrupt all of the care models and the way we're doing things? So I think, as a kind of a final point there, too much is at risk for these seniors. We have a responsibility to them. We have a responsibility to them to help them receive integrated care, deliver things that are important to them, that are valuable to them, that matter to them, that are easy for them to use in a very complex ecosystem with many different players. I think the folks that are going to be the most successful are the ones that can, drive that engagement and then present those insights across the clinical and even non-clinical platforms that are necessary to support their care.
Well, very good. I think that's a great way to close out. Thank you so much for joining me today. I really appreciate the conversation, as always.
Yeah. Thank you, Rebecca.